Hi everyone, I'm Yo and this is VAGINIA. Welcome to our YouTube channel, Knowing, Caring, and Loving Your Lady Parts. So this is another quick tip series for those on the go. And I really want to talk about, especially for all you amazing women, the prevention of pelvic organ prolapse or POP, in particularly those for postpartum moms. Please tune in because I see so much of this in the clinic. So let's get started. So if you're new to the channel, please don't forget to hit that subscribe button and tell your friends, and let's talk about the POP or pelvic organ prolapse. So unfortunately, I see a lot of prevalence of pelvic organ prolapse in the clinic, especially with my postpartum moms. And that's why I think it's so important just to go over some tips. And I don't know whether it's because there's heavier babies or women are trying to get back to doing their activities sooner than they should. But there's basically, I see more and more of this at the clinic. And also I know that specialists are seeing that more as we age. So let's tackle this early. Big thing is, number one, check yourself out. A lot of women are afraid to do that postpartum, but yes, look at yourself so you know your baseline. Yes, you're looser, you've had a vaginal birth, but things are not normal if they're hanging out. They definitely can improve as you recover from your birth, but it's not normal to have things hanging out. Secondly, what you want to do is make sure you engage those pelvic floor muscles. Start working them and getting them learning what to do again, especially after they've been stretched quite a lot. Okay, so because they remember, hopefully you've been doing it, you did them prenatally, right? So get them working again and bulk them up so they are supporting your pelvic organs again and learning what to do, which they did before you had your beautiful baby. Number three is you want to minimize pressure down in the lady part region. And keep that in mind when you're doing any activities, in particular, any squatting or lifting activities. And I know you have to lift your baby, but just be careful and try to minimize pressure in that area as much as you can. So the technique that you want to do is initiate the pelvic floor first, and then you want to recruit the transversus abdominis. So think of zipping up from the groin up, or the zipper is going groin up. So you're recruiting everything. So the pressure is all pushing up and not pushing down the pelvic floor. You're breathing out at the same time. You keep breathing out. Everything is engaged. And then you're lifting. Okay. So squeeze pelvic floor, transversus abdominis. As you're breathing out, keep breathing, pull everything close, and then release, okay? So you're minimizing pressure, pushing down, you're breathing out, and that's really important. So remember, you don't want to hold your breath because as you can see, if you hold your breath, that will push down on the pelvic floor organs, and you want to minimize that. Okay, so we want to minimize any pounding down on that pelvic floor. Ladies, I've had 2 kids, and if anything I've learned now, if I had another one, and I won't because I'm too old, is that take care of your pelvic floor. Be kind to it. Let it rest and let it catch up to the rest of your body. You know, it's amazing what we do. We have a kid and then we get back going again, right? Let it heal, let it start working again, let it start supporting the pelvic organs better before we actually do some heavy exercises on it. Okay, so be kind to your pelvic floor. Give it a chance to catch up to everything and let yourself just enjoy and let your body heal, because it's pretty amazing what we go through, and it is quite traumatic, and I think we forget that as mothers. And honestly, if I would have done it over again, I would have probably given myself a little bit more time to get stronger and heal before I went running myself, and I've had 2 kids. Give it a chance and it'll reap benefits in decades ahead, trust me, because I am there. And ladies, you're probably going to ask me, what about running and getting back to your activities? I would really highly suggest just to be kind to your pelvic floor and let it heal and let it get back to supporting your pelvic organs again before you subject them to all this compression, whether it is running again, trying to do a marathon, right? Get those pelvic floor muscles healing. It's amazing what we go through with birth. So let it heal, let it hypertrophy and get its bulk back, and it remembers what to do before you start putting pressure on it. So thank you everybody for tuning in to this quick tip video about pelvic organ prolapse prevention and management, especially postpartum. Please don't forget to hit that subscribe button, tell your friends, and we so look forward to seeing you soon.